Mental Health Watchdog here. I collaborate with Citizens Commission on Human Rights in investigating, documenting, and exposing human rights violations in the field of mental health. And believe me, there are many. CCHR is a nonprofit, non-political, and non-religious mental health watchdog organization, which has been around since 1969. Now, if you're thinking, what? Why would our mental health system need a watchdog? Well, there's no shortage of reasons, and I'm about to take up one of those reasons right now. Take a minute and put yourself in the mindset that you've never heard of psychiatry or any of its therapies or practices. Are you there? Okay, good. Now, I'm going to give you some information, and I want you to monitor your immediate reaction upon hearing it, okay? Trust me, here we go. To cure severe depression or anxiety, try this. Affix an electrode on each of the temples of the human head and zap hundreds of volts through the brain for several seconds. This will induce what is called a grand mal seizure, which is defined as an episode of severe and abrupt muscle spasms and jerks throughout the body, causing violent muscle contractions and a loss of consciousness. A rubber gag is placed in the patient's mouth so he doesn't bite off his tongue or swallow it. He will be rendered unconscious for some time after the treatment. The blood pressure, pulse, and breathing usually increase. Once awakened, he will be in a severe state of disorientation and confusion for a few hours or more, and will most likely have himself a really bad headache. Nausea and muscle aches usually follow. In the aftermath, there is loss of memory and damage to brain cells. This would just be one of a number of similar sessions in a full regimen of treatment. This procedure would be called electro-convulsive therapy. Sounds horrifying, doesn't it? I wouldn't want to go through such a thing. Well, I was as shocked as you are when I learned that this treatment is still being used in mental health facilities around the country. Yes, it is still being used. As brutal as this therapy appears to be, I decided to give it the benefit of the doubt and look at it as unbiasedly as possible. After all, this treatment is approved by the Food and Drug Administration and administered by the American Psychiatric Association. Two organizations we should be able to trust, right? So then, how could electroconvulsive therapy actually help a person? Well, let's start with defining the words. Therapy is defined as an action, usually a treatment, designed to bring relief or rehabilitation to a disabled physical or mental condition. It comes from the Greek word therapia, which means healing. So, it's safe to say that therapy has a healing quality, and some relief would most likely be present. Electro refers to electricity, or the use of electricity. Convulsive is defined as producing or consisting of convulsions. Put them all together, and you get a definition such as this: the use of electricity to bring about convulsive activity with a therapeutic and healing result. So if there is therapeutic value to this procedure, then the end would certainly justify the means, no matter how barbaric these particular means may be. Let's continue our research. Now, I don't know a whole lot about electricity, but I do know about pain. And just getting a shock from the simple wall socket could be pretty painful. I happen to know this from experience. It's not something I'd like to repeat, if you know what I'm saying. A wall outlet usually has 120 volts of electricity to it. With ECT, the patient is given up to 460 volts of electricity straight through the brain, and for as long as 5 to 6 seconds. Some applications vary. This being true, then pain, likely overwhelming and intense, is unavoidable with that much voltage traveling through the human brain. This is quickly starting to look like anti-therapy to me. Well, let's keep going. Let us look at the reason ECT is even administered. Per WebMD, it states, doctors use electroconvulsive therapy to treat severe depression when all other treatments don't work. Sometimes they also use it to treat other mental illnesses such as schizophrenia. All right, unless I'm mistaken, it appears that if one were to be just too depressed or their mental illness too severe and other therapies have failed, then ECT would solve it, per this quote. I'm trying to be open-minded here. Now, let's look at what electricity is and does. It is a miraculous and extremely helpful addition to the human race. we've jumped light years ahead in progress since electricity was discovered. Since it came about, we can see better, we can communicate faster and to anywhere on the planet. We can watch TV via a small device the size of our palms, and we can refrigerate or heat our food with immediacy. However, other than using electricity as a consumer, I don't really know very much about how it works and what it is potentially capable of. Since this subject is a bit out of my zone, I think the wise thing to do is to just go talk to an electrician. Yep, that makes sense. Okay then, I'm off. Hey Art, how's it going?
Hey, good.
Great. You're an electrician, right?
Yeah.
Okay. Do you mind if I ask you some questions?
Not a bit.
All right, good. Here we go. How long have you been an electrician?
About 43 years.
Wow.
Yeah.
Okay. Well, can you define electricity in simple terms so one and all can understand it, please?
I'll give it a shot. So basically, it's like you have a force that's created, like at a power plant, say. That force is sent to one's home, business, and then that is used for various tasks we have, lights, plugs, charging your car, things like that. So it's a force, it's an energy, and electricians control that essentially by putting wires and stuff in the house and switches and plugs. It's controlled that way so that it can be used without killing somebody, without burning someone's house down.
I see.
Things of that nature.
Okay. How much electricity can a body take before it is damaging?
I know fractions of an amp can kill a person under the right circumstances. Okay, so just the amount of a 100-watt light bulb, amount of current in the right circumstance, it can kill somebody. Mm-hmm. So, yes, it can damage the body easily under the right circumstances.
Okay.
Yeah.
Can someone die from electricity?
100%.
For example?
Okay, the right circumstances would be water. So water and electricity just don't mix at all. So if you happen to have your foot in a bucket of water and you touch the electric wire, well, that would be it for you.
Right, so let's not do that.
Don't do that.
Don't do that. What would the therapeutic benefit be in shooting 300 to 400 volts of electricity through the frontal lobes of the human brain?
It doesn't seem therapeutic, simply because I've been shocked before many times, and that electricity going through, say, my arm or my whatever, it hurts.
Yeah.
So.
Right. Okay. In your opinion, as an electrician and not a psychiatrist or doctor, of course, can electro-convulsive therapy damage the brain permanently?
Yes. Just because of my own, how I've felt after I've been shocked personally, just working with house current.
Right.
It can't be good because the brain is like a circuit board essentially for the body. So if you fried your computer, fried the circuit board on your computer, then it would be toast.
Okay, one more question.
That's okay.
How much do you think it would cost via the local electric company to use 460 volts, thereabouts, of electricity for 6 to 10 seconds, let's say?
It'd be pennies, but
round up.
50 cents.
Okay. Well, you've been very helpful.
Cool.
Thank you very much.
You're welcome.
We'll catch you later.
Thanks, Joey.
Okay, I'm back and I changed my shirt. And now we know quite a bit more about electricity. So what do we get from all this? Is ECT safe and effective? Does it actually get the results psychiatrists and other mental health professionals say it would and does? Well, let's recap what we've covered on the show. ECT is prescribed to treat severe depression and other mental conditions such as anxiety and schizophrenia. ECT consists of zapping up to 460 volts of electricity through a live human brain for seconds at a time. During ECT procedure, a grand mal seizure is induced, creating many adverse reactions such as memory loss, headaches, brain cells are damaged, a state of confusion follows for some time. The word therapy means relief, rehabilitation, and healing. Electricity is a miraculously helpful addition to the human race, but it could also be quite dangerous if misused, and it could even cause death. ECT is quite an expensive therapy, despite that the amount of electricity actually used costs only pennies. And here are a few more facts I've researched about ECT. There has never been a clinical trial in which electroconvulsive therapy was found as safe and effective. The FDA reports that ECT carries such adverse effects as cardiovascular complications including stroke and heart attacks, cognition and memory impairment, physical trauma, manic symptoms, prolonged seizures, worsening psychiatric symptoms, and death. Yes, the FDA reports that you could die from this treatment. The FDA recently reclassified ECT's danger status from stage 3, which is the highest risk and very dangerous, down to a stage 2, which is not as risky. It's in the same category as condoms and contact lenses.
And remember, I just mentioned that the FDA reported that you could die from ECT.
An ECT treatment can take between 6 and 12 sessions, and each session usually runs about $2,500. That would mean a full treatment could run up to between $25,000 and $30,000. Per WebMD, ECT is never used on someone who doesn't want it, which is untrue for involuntarily committed patients. The mental health system is clueless as to how ECT is supposed to work. For Johns Hopkins Medicine, no one is sure how ECT helps certain psychiatric disorders. Well, I personally don't see any therapeutic value in this procedure. It's not even financially therapeutic. So if you give a patient who is suffering from deep depression enough electricity through the brain, would he still be depressed or suicidal? Well, he'd most likely be quieter and more apathetic and inert, but rehabilitated or cured? Would his symptoms actually be reduced or relieved? Or would he be scarred for life? Maybe after enough ECT sessions, he wouldn't even remember how depressed or manic he was, along with losing vast chunks of memory in general. Well, I can only conclude based on what we've covered here that ECT is not therapy. It actually appears to be more like, I hate to say it, torture. It's a bit confusing because they call it a therapy. Honestly, when I hear that psychiatric patients are given treatments like being locked up in a facility with very little freedom, forcibly drugged, their brains zapped, it actually reminds me of those experiments the Nazi doctors did on the Jews in the WW2 prison camps. It's not too far off from that if you look at it. And we all agree that that was a horrifying chapter in nurse history. This leads to some inevitable questions. If ECT is so barbaric and harmful, why then is this procedure currently being used by the American Psychiatric Association? And why is it not only approved by the Food and Drug Administration, but its danger status reduced from high risk down to the same category as using contact lenses or condoms? And why on earth does ECT cost so much to administer? And here's a good one. If the patient didn't have insurance or he wasn't financially well off, would he even be prescribed ECT treatment? And finally, the granddaddy of questions on the subject, and the one we've been ultimately steering towards. How and why has the mental health system convinced the population, which includes judges and politicians, that this insidiously painful procedure is therapeutic? As I said at the beginning of the show, CCHR is a mental health watchdog, meaning it is an organization that investigates and exposes unlawful and inhumane activities in the field of mental health. Is electro-convulsive therapy inhumane and abusive? Well, you decide. I say, based on all this evidence, that it conclusively is. When you take an honest look at all its parts like we did today, it's hard to honestly believe otherwise. So then what could be done about all this? Well, for one, you can consider this an education. Be in control of your life and don't ever get yourself into a position in which procedures like this are ordered onto you without your personal freedom to approve or disapprove. Research the subject yourself and you decide how therapeutic or not this really is, without any hearsay from professionals swearing by it. Use your logic. We've been sold on the idea that convulsion-inducing pain will cure your mental malady. Look what I just said there. Now that just doesn't seem logical, does it? You can report the offending hospital and psychiatrist to the state medical board. You can file a complaint on the offending psychiatrist. You could contact the patient's rights advocacy department within the offending hospital. And if you or anyone you know has been abused by a psychiatrist or psychologist in any way, physically, mentally, emotionally, sexually, financially, report it to CCHR. If you've witnessed human rights violations in a mental health facility or by psychiatrists or psychologists and wish to blow the whistle, contact CCHR. Here's the email address: abuse@cchr.siliconvalley.org. And before I end, I'd like to offer a challenge to any psychiatrists or mental health staff who swear by this procedure. Come forward and show us how harmless and therapeutic ECT is and undergo some ZAP sessions yourself. If it actually improves your mental health and you turn out mentally and emotionally better than before the treatment, I will eat my words. I'm the Mental Health Watchdog. Stay alive and healthy, and I'll catch you later.
What?